Wait, stop stalling. Let's revise one of the most important topics of physiology, that is cardiac output. In the next few minutes, we will cover its definition, factors affecting cardiac output, Frank-Starling mechanism, and the role of autonomic nervous system upon cardiac output. So, let's revise. Cardiac output. What is cardiac output? The amount or volume of blood ejected by each ventricle per minute is known as cardiac output. What is the formula of cardiac output? Cardiac output is equal to stroke volume into heart rate. Now, the factors affecting cardiac output. Since cardiac output is the product of stroke volume and heart rate, any factors that affect either of the two parameters will affect the cardiac output. The stroke volume is affected by factors like preload, afterload, and myocardial contractility. Heart rate is affected by autonomic influences, that is sympathetic and parasympathetic stimulation. Now preload. What is preload? Preload is end diastolic volume. Increase in end diastolic volume increases cardiac output. Decrease in end diastolic volume decreases cardiac output, which is described by Frank-Starling's mechanism. Now what is this Frank-Starling mechanism? The Frank-Starling's law of heart states that the force of contraction is directly proportional to the initial length of cardiac muscle fiber. The force of contraction is directly proportional to the initial length of cardiac muscle fiber. We will discuss about Frank-Starling's law later. Now let's focus on EDV. The end diastolic volume depends on factors like VVA, V for venous return, V for ventricular compliance, A for atrial pump. Now, what is afterload? Afterload is peripheral resistance. The peripheral resistance is inversely proportional to the cardiac output. That is, in case of vasoconstriction, the peripheral resistance increases, which decreases cardiac output. But in case of vasodilation, the peripheral resistance decreases, which increases the cardiac output. Myocardial contractility. Myocardial contractility is also called the inotropic state of heart. Factors that increases contractility are called the positively inotropic. Factors that decreases contractility are called negatively inotropic. Now, the factors that are positively inotropic are sympathetic stimulation and glucagon. Factors that are negatively inotropic: parasympathetic stimulation, loss of myocardium, hypoxia, hypercapnia, and acidosis. Now, heart rate. Increase in heart rate increases cardiac output. Decrease in heart rate decreases cardiac output. Parasympathetic stimulation inhibits heart rate. Sympathetic stimulation stimulates heart rate. Frank-Starling mechanism. Now, what is Frank-Starling mechanism? The Frank-Starling's law of heart states that within the physiological limits, the force of contraction is directly proportional to the initial length of cardiac muscle fiber. Again, within the physiological limits, the force of contraction is directly proportional to the initial length of cardiac muscle fiber. That is, the force of contraction is directly proportional to the initial length of cardiac muscle fiber. Now, what is the mechanism? Initial length of muscle fiber means the fiber length prior to ventricular contraction. Second, increase in venous return increases end diastolic volume. Third, the ventricular muscle fibers are stretched. More stretch increases the force of contraction. Fifth, more blood is ejected through during the systole. Now, hence the cardiac output and stroke volumes are increased. The graph shown beside is the ventricular function curve or the Starling curve. In the graph, we can see that the y-axis represents the stroke volume and the x-axis represents the end diastolic volume. The graph is almost linear till the physiological limit is active. After the physiological limit is active, the graph becomes constant. Now, the role of autonomic nervous system in cardiac output. Role of sympathetic stimulation. Sympathetic stimulation increases the heart rate and myocardial contractility, which in turn increases the cardiac output. Sympathetic stimulation also causes vasoconstriction, which increases venous return and in turn increases the cardiac output. Now, what is the role of parasympathetic stimulation? Parasympathetic stimulation inhibits the heart rate, which in turn decreases the cardiac output. So, this is a brief revision of cardiac output.